Good evening again. All right, now I gave y'all a whole extra 5 minutes to get them selfies in, make your IG posts, arrange the hashtags for the night. I think all of that should be done by now. I gave y'all a solid 5 from when I first got up here. Good evening once again. I'm Don Calloway from MSNBC and Enviva, the world's largest renewable energy company, and I am so glad to be back with you all celebrating 25 years of the National Minority Quality Forum. And please. And this our 20th annual summit convening the world's greatest healthcare delivery and practice policy minds. 20 years is a long time. When you talk about sustainability, we've been around this town for a minute, Congresswoman Kelly. I've been around longer than you, and I've seen a lot of groups have a couple of cool shindigs, but 20 years in is something to be quite proud of, Dr. Puckrein. So congratulations to you and the entire staff of the National Minority Quality Forum. Before we get started, I want everybody to hear this. There are some brothers and sisters who got here long before us to set up, will be here long after us to clean up, and will look out for us throughout. So thank you, and please let's show our appreciation to our fantastic wait staff. Thank you all so much for being with us throughout this evening. This is my 4th time doing this. I've been very, very blessed to join the National Minority Quality Forum 4 times, and we have seen the world change a whole lot over the last 3 years. I think we started in 2019. We've had a couple of virtual convenings now, and this is our 2nd, if not 3rd, in person. But you all, as the healthcare minds of this country who have lifted the most vulnerable out of their states of healthcare insecurity, you all have now guided us through 2 viruses. Well, 1 is almost done, so thank you all for all of the guidance and assistance and masking and vaccine encouraging and science and good sense that y'all have talked in helping us get past COVID-19. But it was a virus before that, and you all organized and voted and helped us get past that one as well. So congratulations to all of y'all in here for now having knocked out 2 viruses off the strength of yourselves. I'm sticking with this crew. Y'all take out viruses, and I am deeply, deeply appreciative. A moment of personal privilege. When I came here 3 years ago, I distinctly remember I thought I looked really, really good. And in my Uber ride over, I took an Uber Black. I was really feeling myself that day. And I thought I was so fly that I was like, there's this gal, and we text a little bit, but I'm gonna FaceTime her because she needs to see this. And, and she didn't pick up. But I'm glad that she didn't, because my suit was a little tight and I was struggling through the MC activities, responsibilities, because it was pressing. It was pressing on me a little bit. But said gal eventually picked up the call and married me and got me on a vegetarian diet. So I want y'all to meet my wife, Deanna Dorsey Calloway, who I have now thoroughly embarrassed. But I say that to say that I'm not asking you all to go vegetarian and be down 20 pounds. Not everybody's Don Calloway, I understand. But I am saying, as healthcare leaders, stop eating that crazy stuff. Y'all know better than that. And tell our people to stop eating this crazy stuff. We can collect all the data we want, and we can collect and engage in all the applied science we want, but healthcare starts with us in our community. Stop eating that crazy stuff. I know it's delicious, but stop eating that crazy stuff. I know it's deep fried and goodness and sugar dripped. We gotta stop. Outcomes start with us, right? And I was rocking, I seen some red bottoms, I seen some cufflinks that I was quite envious of. Y'all don't live in food deserts. Let's get it together, right? It starts with us. It starts with us. Y'all look fantastic, I should say. Ladies, you look amazing. Brothers, I seen some of y'all got the sponges out for the nappy froze. Fantastic. Non-binary family looking amazing. Oh, full inclusion here at the National Minority Equality Forum. We do believe in that, and always have, Dr. Puckrein. So thank you all once again. Look, I'm getting all my jokes out now because I'm not coming up and down these steps no 5 or 6 times. So thank you all so much once again for having me. Thank you to Congresswoman Robin Kelly for your continued leadership as chair of the No, y'all need to hear this. Y'all need to hear this. Know why you clapping. Don't just jump in with the obligatory claps. Hear me out. I know I'm verbose, but y'all gonna hear me out. I got the mic. So Congresswoman Robin Kelly, since she has been in Congress, has been the chair of the Congressional Black Caucus's Health Care Braintrust. That's incredibly important. The Congressional Black Caucus is the conscience of the Congress, and ergo the world. We need serious thought when it comes to health care. We need serious analysis when it comes to Obamacare and affordable health care and all of the things that health care application is to be in this country. Robin Kelly has led that for the greatest group of the United States Congress, and we thank you for your ongoing efforts. The Congresswoman from Chicago. Now y'all can applaud. Before I sit, I will tell you what I'm going to be doing when I'm sitting down, and that is practicing the phonetic pronunciations of our 40 under 40, because you all are the best and the brightest and the most brilliant, and I'm not going to mess up them names like I did virtually last year and we had to re-record. Brandon will not hold that over me for another 18 months. Both Brandons, actually. So, with no further ado, we welcome Dr. Gary Puckrein, who is the founder, the president, and the chief executive officer, and most importantly, the chief dreamer of the National Minority Equality Forum.
Thank you, Don. So, you know, every 4 years I got to follow Don, right? So you understand the challenge that presents. First of all, I want to thank Congresswoman Kelly and her staff for collaborating with us. I tell everyone, this is like doing a wedding every year for 600 or 700 of your best friends. And so here we are, another wedding. Thank you so much for the collaboration. I want to thank Brandon and the NMQF team and Anita from Congresswoman Kelly and Mia for all of the great work. I get to stand up here, but I don't actually do anything. They do the work, and I get to come up here and talk about all the wonderful things that I just did not do. So, you know, for those who don't know, my doctorate is actually in history. And I'm always thankful that physicians allow me to be part of their conversation. In academia, everyone has their lane, and we tend to stay in our lanes, and somehow I've gotten out of my lane. And I really appreciate all that they have taught me. I've listened very, very carefully over the last 25 years to what they had to say. And one of the things that I want to call to your attention, speaking of history, is that it's only 54 years since 1965. I just want you to understand that, right? So prior to 1965, African Americans in this country spent about 300 years in slavery, right, till 1865. From 1865 to 1965, we lived in segregation. During that period of segregation and inequality, and it was segregation and equality by law, as well as custom, the American healthcare system was born. The modern American healthcare system was born. Started in World War II as part of employment healthcare. And then in 1965, the federal government, seeing that seniors could not get commercial health care, because they were uninsurable by the commercial folks. They couldn't figure out how to write a policy, because back in 1965, if you were 65, you had about 5 or 10 years left of life, and nobody wanted to write a policy on that one. And so the federal government under Johnson came in and created both Medicare and Medicaid programs. For African Americans, those programs led to desegregation of hospitals, because the hospital systems were all segregated. And so the federal government said, well, if we're going to spend taxpayer dollars, y'all got to desegregate. And so kicking and screaming, the hospital systems were desegregated. And by the way, the healthcare societies, the American Medical Association was segregated, right? And I ain't saying they were kicking and screaming when they stopped, but they stopped. And actually, it was at one of our summits like this that the president of the American Medical Association got up and apologized for what AMA had done by keeping African Americans from being able to join AMA. And you should understand what joining AMA meant. It meant that you didn't get continuous education. You didn't get the new science. You didn't get updated. So it wasn't a light thing like joining a club, like a Glee club. This was your ability to continue your career. So by the time we get to about 1980, somewhere thereabouts, we had taken down the infrastructure of segregation. The white-only signs came down. You could get into the American Medical Association, most of the country. And in 1984, Margaret Heckler wrote her report. And the Heckler report said, oh my God, there's health disparity. That's where the health disparities word came from. It came out of Margaret Heckler's report in 1984, right? And so what you should also understand, between 1984 and 2008, with the Affordable Care Act, 48% of African Americans had no health insurance. Now, I know you all go to the doctor, and before you walk in the door, they want to see that card, because that card tells them what I can do with you, how much I can give you, how long I can give it, who can give it to you. And think about it, they had no health insurance card. 54% of Hispanics had no card either, right? And so what they were accustomed to was rescue care. They would go to the hospital in an emergency. That was the health care that we were afforded, right? So 2008, the Affordable Care Act begins to change the landscape, meaning African Americans started to get that health insurance card. By the way, we didn't do a good job telling them what to do with that damn card, right? We gave it to them, but we didn't take a whole lot of time explaining to them how to be good medical consumers. So the National Minority Quality Forum, we got started before the Affordable Care Act. And our summits every year, and this is the point I was getting to, historians are long-winded, so we have to make the point. Every year, we would put up the statistics. African American cardiovascular deaths, cancer deaths, diabetes deaths. I mean, every year it was repetitive. We put up the same numbers. And we would start to say, can we do something about that? Can somebody, instead of putting up some numbers, can we actually put a program together to do something about that? And the moment of transition really occurred, one with COVID and one with Floyd. All of a sudden, America was looking around to say, maybe we've discriminated. Maybe we have discriminated. It's possible, we're not sure, but maybe we have. And healthcare was one of those places where they started to look. And things began to change. I was so impressed by the conversation that was going on in this room over the last 2 days. It was amazing. Young people talking about the future, plans, data. We were not listing the inequities. We were talking about changing the inequities. We're talking about changing the world, right? And so what I've come to appreciate is that we're at that moment of reimagining that slaves and those who fought segregation fought for. We're at that moment. It's our history now. We get to say what we want to be. And I am so proud of the generation that's in front of me. You're going to meet some of them when we talk about the 40 under 40. You're going to meet some of them. And I tell them when I see them, I see the future in your eyes. And I'm comfortable, right? We have done our job. We're getting there. So I'm telling you about the journey that the National Minority Equality Forum has been on and the change that we see. And what we understand is there's a whole new future out there that's being made. And I'm so excited and I'm so pleased. I just can't begin to tell you how great and wonderful that is. So it took us 2 years because of the summit to get back together. But I think those 2 years were well spent. I'm glad you're here. I'm excited that you're here. We're going to celebrate some young folks here. And then we're going to go back home and we're going to get to work, right? Because I think we're at that moment of change. And I'll just say this final thing because I say it often enough. They asked John Kennedy why he was going to the moon. And he said, because I'm unwilling to postpone. And I think that's where we are. We are unwilling to postpone. We are in the moment now. We have to seize that moment and reimagine a healthcare system that provides adequate care for every American. And I want to thank you for all of the work you've done, and we will continue to do together. So thank you so much.
Thank you, Dr. Puckrein, for continuing to be unwilling to postpone for 24 years now. I said 25 earlier. We founded in 1998. Just want to make it clear that I can count because I heard some snickers earlier. But I was correct that this is the 20th annual summit. So 25 next year, and I'm inviting myself back to do this just so I can say 25 and it be accurate. Hello to my fantastic fellow Alabamian, the gentle lady from Selma. Give him a wave, the Honorable Terry Sewell. HR 1, HR 1, HR 4, please forgive me. You all are familiar with HR 4, right? Of course you are. I'm not even gonna give you the chance to let me sit up here looking awkward to a room full of silence. Of course you all are familiar with HR 4 to restore Section 5 of the Voting Rights Act of 1965. Dr. Puckrein talked about that a moment ago, and the Honorable Terry Sewell of Alabama is leading that effort. Thank you so much, Congresswoman. The last time we got together, the Lifetime Achievement Award went to a fantastic leader in healthcare who is no longer with us, but certainly proudly watching the proceedings this evening. So we take a moment to pause and recognize the Honorable, no, he was not elected, but certainly the Honorable Bernard Tyson, former CEO Emeritus of Kaiser Permanente, who has left us but is still in our hearts and certainly in the hearts of the National Minority Equality Forum. Please feel free to give Mr. Tyson a hand. I saw some of you all doing that. Also, the last time we were together, we had the former vice president, current president, was with us. And I think we should invite him back, Brandon Garrett, next year for the Big 2-5, since he knows who we are, he ain't got nothing else to do, and he needs to come back and speak for the Big 2-5. This is why. Of course, it would be great for the forum, but that night I was not able to get a photo with him. That's a problem. It's a problem because I have only one picture with him that I got to keep recycling for his birthday and all that, and folks are like, you don't really know him, you got on the same tie. So I need another photograph with the president. Can we get him here for 25, Brandon Webb? That would be great. Thank you. Thank you for committing on behalf of the White House. A very brief history lesson. Every time I get an invitation to speak or do something of this nature for an organization that starts with national, I accept it with no questions asked. And it's part of why, and part of the reason is why, as Dr. Puckrein was explaining a moment ago, history is always apropos. There is the National Bar Association, and there is the American Bar Association. There is the National Medical Association, and there's the American Medical Association. And if you listen closely to Dr. Puckrein's comments, the National was for one group because we were not allowed in the American. So the National once stood for Negro. Now there is the National Basketball Association. There is no longer the American Basketball Association. These things kind of folded into one. You all will maybe get that as you go to bed tonight. Just think on it. Think on it just a bit. With no further ado, we're going to bring up the Honorable Chair of the Congressional Black Caucus's Healthcare Braintrust, followed by my good fraternity brother and the head of social, what is it? It's really important. I want to get it right. It's so important that I want to act like he gave me the opportunity to get it right, rather than me just forgot. The head of social justice engagement at Amazon, my brother Brandon Webb. Congresswoman Kelly.
Good evening, everyone, and thank you so very much for joining us tonight to close out the 2022 NMQF Leadership Summit and Spring Health Braintrust. Dr. Puckrein, I just want to throw my praise on you like everyone else and give you another round of applause for all the work you do and your staff. And I would be remiss if I didn't thank who I think are the most fabulous staff in Congress, the staff of my staff, the 2nd Congressional District. Thank you guys so much for everything you've done and helping to team up and put this together. Tonight, we get to honor the 2022 40 Under 40 Minority Leaders in Health and the recipient of the Honorable John Lewis Lifetime Achievement Award. This is actually my favorite part, to see the 40 Under 40. As Dr. Puckrein said, you are our future. You make us feel comfortable. You are helping us out so much right now. So you're now and you're in the future. I want to take a moment, though, to recognize the class of 2020 and 2021 40 Under 40 Minority Leaders in Health. If you're in the room, if you could raise your hand, because you need a round of applause. As you know, because of COVID-19 pandemic, we weren't able to honor them in person in the past couple of years, but we're so thrilled to have you with us tonight, and thank you for your work to end healthcare inequalities or inequities. Please join me again in another round of applause for our 2020 and 2021 recipients. We have to pour it on for them. For many of us, we spend our days identifying and working to address systemic health inequities. It can be tough work to focus on the progress we still need to make. But tonight, we look to the future. The members of the 2022 40 Under 40 class embody the promise and hope for a future where health inequities and disparities do not exist, where everyone has access to quality, affordable health care, and where the color of your skin, the zip code you were born in, or the language your parents taught you to speak does not determine your life expectancy. I know that with these young people working to improve health outcomes and the healthcare system as a whole, the possibility of an equitable healthcare future is so very bright. Thank you once again for joining us, and I hope you have a wonderful evening recognizing our award recipients and celebrating another successful NMQF Leadership Summit. And with that, I'll take the liberty to introduce my former Chief of Staff, Brandon the Wonderful Webb.
Dr. Puckrein, I have your business card up here. So. Good evening, everyone. It's good to have the band all back after 2 years, so it's great seeing everybody. You all look great. My name is Brandon Webb. To a few of you in the room, I am still the other Brandon. I'm going to own that. I'll embrace it. I want to acknowledge another Brandon that's in the room, Brandon DeFulvio, who also works for Robin Kelly. So there is another other Brandon in the house. I'd like to congratulate the National Minority Equality Forum, Dr. Puckrein, Congresswoman Kelly, and my forever boss, Congresswoman Robin Kelly, and the amazing NMQF team for this wonderful leadership summit on health disparities. The last time we were here was obviously pre-COVID, an amazing celebration. The now president was in attendance. But I want to acknowledge tonight we are history making. We have the youngest 40 under 40 in attendance, Mia Key's son, who is the best dressed human being I've ever seen with the most wonderful head of hair. So I just want to acknowledge that barrier-breaking moment of not even a year, but 40 under 40 is 40 under 40. At Amazon, we believe our communities, our planet, and future generations need us to be better every day. And that's why we begin each day with a determination to make better, do better, and be better for our customers, employees, our partners, and the world at large. For nearly 25 years, as Don Calloway reminded us, the NMQF has been making better and doing better for the public health community. They've worked to provide innovative, evidence-based, data-driven initiatives to guide programs, to eliminate the disproportionate burden of premature death and preventable illness for racial and ethnic minorities. It was a similar vision that led us to launch Amazon Care 3 years ago. We wanted to bring the most patient-centric healthcare to customers where they needed it. Amazon Care combines the best of virtual care and in-person services, and as more and more organizations look for convenient, comprehensive, high-quality healthcare solutions, we're excited that Amazon Care's unique care model can work in tandem with similar innovative efforts. Together, we can raise the bar for health outcomes in this country. And it's with this innovative spirit in mind, Amazon could not be more honored to partner with the NMQF, and we are grateful for the opportunity to sponsor tonight's 40 under 40 Minority Leaders in Health Gala. The 40 individuals that we honor this evening have worked to advocate, innovate, inspire, and engage in communities to bring about change in the health arena. As Congresswoman Kelly so rightly put it, our country needs new leaders to fulfill the dream of eliminating health disparities in a generation. Fresh ideas, new approaches, and are needed to decrease health disparities for minority communities. Amazon could not agree more. We thank you for your advocacy and the opportunity to stand by your side in this fight. So again, thank you to the attendees, congratulations to the awardees, and press on NMQF. Thank you.
Good evening again. Please continue to enjoy your dinners while we introduce this year's 40 under 40 award winners. I'd like to ask Dr. Puckrein and Congresswoman Kelly and Secretary Becerra to join us on stage. Award winners, as your name is called, you'll come across the stage, past me, take a photograph with the three principals and your award, and we'll make sure you get a good one. Your mom and daddy will be very, very proud. And, ready? And here we go. the future of healthcare practice, science, and leadership and thought. First, Dr. Aaron Adams. MD, MPH from the New York University Grossman School of Medicine. Luye Adesanya, MPH, MBA, CPH from the University of Texas Southwestern. Joshua Anthony, MD, MBA from Yana Health. Shout out to Dr. Anthony with the photo on the tie knot. That's that high school I know I'm fly. Congratulations, Dr. Anthony. Dr. Minerva Angelica Romero Arenas, MD, MPH, FACS. From Weill Cornell Medicine. Dr. Kavita Shah Aurora, MD, MBE, MS from the University of North Carolina at Chapel Hill. Dr. Disha Bannock from the United States House of Representatives, Office of the Gentleman from Brooklyn, Congressman Hakeem Jeffries. Dr. Tyson D. Bell, MD, MBA from the University of Virginia School of Medicine. Joelle Burvell, MS from the Elson S. Floyd College of Medicine. Alec Kalak, BS, from the UC San Diego School of Medicine and Herbert Wertheim School of Public Health and Human Longevity Science. Dr. Nicole Del Castillo, MD, MPH from the from the University of Iowa's Carver College of Medicine. Dr. Faith Crittenden, MD, MPH from the Yale New Haven Hospital. Dr. Miraj Desai, PhD, from the Yale School of Medicine. Dr. Olayinka Stephen Fadawole, Farm D from Walgreens. Dr. Eldecia L. Granger, MD, MPH, FAAP, FACP from the Mitra Corporation. Dr. Aubrey Grant, MD, from Georgetown University, MedStar Heart and Vascular Institute. Dr. Sejal Hathi, MD, MBA, from the Johns Hopkins School of Medicine. Mathri Jha, licensed clinical social worker, Master of Public Health, from the Morehouse School of Medicine. Dr. Ifedayo Kuye, MD, MBA, from the Johns Hopkins School of Medicine. Dr. Joy Leo, MD, from the Kaiser Permanente offices in Oakland. Dr. Camila M. Mateo, MD, MPH, from the Harvard Medical School and Boston Children's Hospital. Dr. Kendra B. McDowell, MD, MPH, FAAP, from the School District of Philadelphia. Dr. Chelsea Moreland, MD, from the Life Cycle District Primary Care. FAMU. Dr. Tamia S. Nolan, PhD, APRN CNP, ANP, BC, from the Ohio State University College of Nursing. Dr. Olabanga T. Akasanya, MD, FACS, from Thomas Jefferson University. Dr. Estefania Oliveros, MD, MSc, FACC, FACP, from the Lewis Katz School of Medicine at Temple University. Dr. Adewumi Ade Osanubi, from the Warren Alpert Medical School at Brown University. Dr. Aisha Pamaku, JD, from the San Francisco Foundation. Paulo G. Pontemayor, MPH. From the Catholic Health Association of the United States. Dr. Tracy K. Paul is not here, but we acknowledge her as well. LaShanta Rice from Johnson & Johnson. Dr. LaShanta Rice, PhD, MPH. Dr. Witsa Saeed, MD, FAAP, from the Commission Corps Headquarters, Office of the Surgeon General.
It's a celebration.
Dr. Nakia N. Shoal, MD, MPH, MHS, from the Johns Hopkins University School of Medicine. That's 3 if you're counting. Johns Hopkins is cleaning up tonight. Lieutenant Dr. Dantrell L. Simmons, PhD, MA, from the Substance Abuse and Mental Health Services Administration. In her absence, we recognize Dr. Alexandra M. Sims, MD, MPH, FAAP, from the Cincinnati Children's Hospital Medical Center. And Dr. S. Monica Soni, MD, from New Century Health. Dr. Kevin U. Stevens Jr., MD, MPA, from Oak Street Health. Dr. Earl Stewart Jr., MD, FACP, from Wellstar Medical Group of Wellstar Health Systems, Incorporated. We recognize in their absence Dr. Eloho Ufamata, MD, MS, FACP, and Dr. Tiffany Bell Washington, MD, FAPA, DIPABOM. Oh, she's here. Oh, very good, very good. Dr. David Trotter, MD, FACEP, from Advocate, Illinois Masonic Medical Center. She is here with all these letters behind her name. Dr. Tiffany Bell Washington, MD, FAPA, DIPABOM, DIPABLM, from the Harvard T.H. Chan School of Public Health. While she's up here, look at the shoes. They shining. Congratulations to each of our 40 under 40 honorees. You all joined a wonderful group. And please all come back up and take a group photograph. And Congresswoman Sewell, if you're still here, but all of our awardees, please come back. And, oh, we're gonna do it at the end. Very good. Thank you all so much, and congratulations to all of our awardees. Dr. Puckrein, you're not allowed to leave. I think I heard somebody whisper, oh, he's sweating. Yes, yes, I am. Dr. Kelly, neither are you permitted to leave, Congresswoman. The Brandon has spoken, and they're asking you to come back.
So, you know I can tell stories, right? So, I'm going to tell a story. So probably before we did summits, we used to do a dinner. And we were an inconsequential organization as DC would go. But we would extend invitations. And we extended an invitation to Xavier Becerra to come and have dinner with us And we were shocked he came. And it was such a really great evening. And that tells you so much about who he is. Because, truth be told, he had no rhyme or reason to come to our dinner. He's gone on a long way since that dinner. He was one of the drafters of the Affordable Care Act, and I told you the implications of that act for millions of Americans. He then defended that act as the California Attorney General when, unbeknownst to lots of us, some people didn't want folks to have health care. And so he defended that. He's now in a role to help further enact that piece of legislation, to make sure that it reaches its dream, so that millions of Americans who didn't have health care before have health care. And it is not just African Americans and Hispanics, and surely we need it, but he's looking out for others like the LGBTI community to make sure they're not discriminated against. He's trying to protect reproductive rights so that women have access to quality health care. And so we are just so proud and pleased to present him the John Lewis Award. The John Lewis Award recognizes a lifetime achievement of good trouble. And we want to thank Secretary Becerra for all the good trouble that he has created. Thank you.
It's an honor for me to be here because I had the pleasure of serving with Secretary Becerra in the House of Representatives. And he was a great congressman, like he was a great attorney general, and he's a great Secretary of Health. So I'm so proud of you, and this is so well deserved.
So, Dr. Puckrein, if I could say to you, to a dear friend and colleague, Congresswoman Kelly, to Congresswoman Sewell, who I know is here as well, you go to those events because you want to always make a difference. And even though sometimes you don't have the national reputation, you strive and you strive and you strive. And today you can say, you want to invite that guy named Joe to come back again and be a guest at your summit. And guess what? There's a good chance that he'll go. And now you're going to probably get the John Lewis Lifetime Achievement Award recipient to push the President of the United States to come as well, because I got to keep my reputation going of doing some good deeds with you all. So I want to say thank you for acknowledging the work that I've done. I will tell you, you had me at hello the moment you said that I would be receiving an award with John Lewis's name on it. To be associated with someone who was a dear friend, I served with him for 24 years in the House of Representatives. I walked across the Selma Bridge so many times in that community. I remember his fights. He would say, you got to get into good trouble. He'd also say, you got to get in the way. And he really meant it. And I always take those words to heart. My father, Manuel Becerra, would say it slightly differently. He'd say, tienes que enseñar ganas. You have to show ganas in Spanish. Don't look it up, G-A-N-A-S, because my definition is better. It's gut, grit, and game all combined in one. That was John Lewis. But John Lewis in such a respectful way. You know, John Lewis would raise his voice, but not at anyone. He would raise it to reach so many people. And my dad never had a chance to reach a lot of folks. He never got past the 6th grade, but he knew what ganas was, and he had it. And I will tell you that we need to show ganas a whole lot, because we got still lots of stuff to do. So I want to just say from the bottom of my heart, thank you for recognizing me for having ganas, for getting in the way, but quite honestly, doing, Dr. Puckrein, what you and these 40, under 40 who are so impressive are going to be doing for a long time. We just got to get in the way a whole bunch. And so thank you so much for that.
I'll get them to come get it.
Hit us in a bad place, and I wonder what's good for. I've been in the right place, but it must have been the wrong time. My head is in a bad place, but I'm having such a good time. I've been running, trying to catch hung up in my mind. Just got to give myself a good talking to this time. Just need a little brain salad surgery. Got to cue my insecurity. That I've been in the wrong place, but it must have been the right time. I've been in the right place, but it must have been the wrong song. I've been in the right place.
So I thank you for your. Give me a chance to turn it on. I want to thank you for your attention. So Secretary Becerra has kindly agreed to have a little bit of a conversation with Congressman Kelly and myself. And we thought the way we would do this is we would ask a few questions and talk about American healthcare. Today, we had a press conference for HEA, the Healthcare Equity and Accountability Act. This is an act that started in 2003, so you know, the historian in me, understand that, and it's a bill that the Caucus has been working on, and Secretary Becerra, when he was a member of Congress, contributed and worked on that bill as well. One of the provisions in that bill is about data. And anybody who knows the National Minority Equality Forum know we are about data and improving data collection on minorities in particular, Americans in general. So I wanted to start by asking the Secretary a little bit about how HHS is going about fulfilling some of that data needs that we all have.
So Gary, one of the things that we are doing is we are trying to bring together at the federal and local level those entities that collect data. It'd be surprising you to learn that we don't have authority in many cases to actually get that data that's being collected. On COVID, we had to beg, in certain states, we had to beg providers and local and state governments to provide us the data they were collecting so we'd be able to determine how best to use our resources. And to really understand the critical nature of data, just take a look at the census and how, because this census so undercounted Black and Latino communities, billions of dollars could be lost to these neighborhoods because people are missing. They are not available, they are not reachable because they never got counted. And we don't want to miss anyone when it comes to healthcare, because we saw what happens, as with this pandemic, when you don't exist. You get missed at the most crucial time. And that's why so many Black and brown families were losing people, losing loved ones at a rate that you didn't see in other parts of America. And so we understand the importance of data, and not just data, quality data, because what you bring in, you have to spit out, and if you've got bad inputs, you're going to have bad outputs. And so we want good data to drive every decision and every dollar at HHS.
Secretary, my office has been working on the issue of maternal mortality and morbidity almost since I came to Congress, and I will admit I had no idea it was such an issue in the United States of America until someone in my district called to tell me about what happened to her friend. So this is something really near and dear to my heart. Can you talk a little about what your agencies or what's going on across your agencies to deal with this issue?
And so maybe folks in this room know, but most of America doesn't, as Congresswoman Kelly just mentioned. We have some of the highest rates of maternal mortality and morbidity in the world. We have rates that compare to many developing countries in certain parts of our country. And it wouldn't probably take you much to guess what parts of the country that is. And so we have an effort right now underway where we are targeting maternal health in mostly Black and indigenous communities, because that's where the rates are highest. And we're doing a couple of things. We're going to take much of what Congresswoman Kelly, Congressman Sewell, and the Black Caucus has done to put a major investment in doulas, because we know that if you provide care early and do it in community, there's a better chance that that pregnant woman will deliver a healthy baby. We're also now, first we challenged last year, and now we actually, as of April, have the money to let every state in the nation, not through a challenge, but through a direct application, join the federal government in providing through Medicaid, which, by the way, Medicaid provides the delivery services and pays for the delivery services for about 42% of all deliveries in the nation. And in the Black and brown community, that's obviously far higher a number. But today, I can tell you that we are offering every state a chance to provide a woman who receives her pregnancy care through Medicaid, not just 60 days of coverage, which is a current law under Medicaid, but 365 days of coverage after she delivers her baby. And we're hoping, we had about 5 states when we had to make it a challenge last year. Now, because of the Congress members' work, we're able to actually now fund these states to join in the effort. And we've got another 11 or 12 states who have said they want to come in, the District of Columbia as well. And I will tell you, it will be a life changer for these expecting moms to know that they'll actually have a chance to get good quality care for themselves and their baby, not just for 60 days, but for the full year.
And I have to say, Illinois was the first state.
Yes, it was. Illinois was the first state to take on the challenge. Then come on board. That's it.
So it must have been about 2 weeks ago, we learned that one of our good friends' son, 16 years old, committed suicide, hung himself in the family home. The family came in and had to cut him down. We went to, my wife and I, we went to the funeral. And I just have to say it was the most painful experience I've ever seen in my life. And this was an affluent child. He had everything to live for. He had affluent upon affluent. To tell you how affluent they were, they hired private jets. I mean, this is not poor folk here. And the parents were just doubled over in pain. It was the most incredible experience. And what I learned since then is that our youth are in trouble, right? The pandemic, my own daughter lost her graduation from high school, was virtually impounded at college, where she could only speak for a year. I think it was about 6 people that she could talk to for a year. And that's the pandemic. We're not going to get the climate change and the craziness of American politics and all of that other stuff. So there's a real challenge here about our youth. And so the question I would ask the Secretary is mental health. How are we doing? What can we do about mental health, particularly for our young people?
Well, if you recall in the President's State of the Union address, he said we're finally going to make an investment that lets us actually treat mental health the way we treat general health, physical health. We've had a law in the books that said that we should, but rarely have we seen it implemented. And we are now going to have the resources, if Congress is able to pass the president's budget, to put $5 billion every year for the next 10 years into mental health services that we didn't see before. That will be a game changer when it comes to mental health services. We're also moving to make sure that we have changed the paradigm when it comes to the way we treat drug addiction. It used to be that the 20th century model was, the paradigm was, you stigmatize. You really look down on people who have this disease, drug disease. And we've decided we're going to change that. We're going to continue with the prevention work. We're going to continue with the treatment work. But we're adding a couple of very important elements to our strategy. We're going to now look toward harm reduction. We're going to try to keep someone not just alive, but we want to get to you while we can have a chance to help you turn your life around. And not only harm reduction, but after the treatment, we're going to try to follow you in recovery and provide you with recovery support. Because too often, after they finish the treatment, we wave goodbye and wish you luck. And before you know it, they're back at it again. And so we intend to try to be there with them for a longer period of time during that recovery period. And then finally, I'll mention something that's very important that I hope with Congresswoman Kelly and Congresswoman Sewell and the members of the Black Caucus, and just quite honestly every member in Congress we do, is we have a chance to launch in July, mid-July, the new Suicide Prevention Lifeline, 988. And I hope that you will help us, especially those of you in the health profession, because right now we have a patchwork of hotlines throughout the country, all separate within the states, even within the states handled differently. We're now trying to bring it all together into one network. We're trying to serve as the glue. We've put in over $300 million working with the states so we can get them to coordinate, because we want to make sure if someone is going to call, and no longer will it be a 10-digit number, area code plus a number, it's now going to be like 911, 3 digits. Anywhere in the country, you dial 988 and you'll get some help. And what we want to make sure is that there's actually someone who will answer. And so no one should call when they're about to make that decision of what to do, and they make the decision to go in the other direction when they hit that fork in the road, and not take their life, but to actually call. The last thing we want is for them to get a busy signal or to be put on hold. And so we need to work, because we're only as good as those local agencies are. And so we're trying to do everything we can to make sure on July 16th when we launch, if you call 988, you're going to get help.
And the last question we have for you is something I ran on, and that is gun violence prevention. I started my 10th year in Congress about 2 weeks ago, and really when I look back over the last 9, we have not conquered or even come close to conquering the problem. The House passed a background check bill twice, but it went to where bills go to die, the Senate, and we passed the Charleston loophole twice, and nothing has happened there. But can you talk a little bit about what you're doing in your agency and what can Congress do to support you?
So Congresswoman, first and foremost, one thing that Health and Human Services can do is let the world know that violence, especially gun violence, is a health issue. It's not just a public safety issue, it is a health issue that we must tackle within those agencies that deal with health. And the more we do that, the greater the chance that wellness, good health will follow in all these communities. One of the things that we are doing is we are trying to seed programs. We were in Chicago. It was a Bright Star Church, I think, in Chicago, where we spoke to a number of folks who are coming together to try to end the violence in their community. And they're working with the University of Chicago. And what we're trying to do is seed some of those programs that are on the ground that are making a difference. And while we don't have the direct relationship with a lot of these programs, because most of it is it's community investments and through the more socially traditional ways, we believe that we can at least come in with some of the programs that we have to push the healthcare button and say that we're involved, because the more we save a life and the more we keep violence down, the better the health will be in communities. So we're trying to impress upon everyone, especially policymakers around the country, that violence, especially gun violence, is a healthcare issue.
It's a healthcare crisis, and we just sent a letter to leadership to let them know that, you know, we need to keep moving. We cannot stop. We don't care if there's an election coming up or what the situation is, but people are dying on the streets every single day.
Well, Secretary Becerra, I want to thank you so much for taking time out of, I know, is a busy, crazy schedule to be with us this evening. We thank you so much.
Absolutely. Thank you all very much. Congratulations to you all.
Thank you all so much for coming out. Before we go, we'd like to hear from our president and CEO and founder, Dr. Gary Puckrein, for some closing remarks, in addition to closing remarks from Congresswoman Robin Kelly.
Can I get your attention? I promise this will be the last of it. So, first of all, I'm not going home tonight without thanking my wife for all that she does that allows me to do what I'm doing. So, Joanne, please stand up. Just stand up. My wife, thank you. So the reason why we get to do this is because we have sponsors. And I want to thank each of our sponsors individually. So give me a moment to thank them. Amazon, the American Medical Association, the Association of Medical Colleges, Astellas, Baxter Healthcare, Biogen, Blue Cross Blue Shield Association, Bluebird Bio, Bristol Myers Squibb, Centene Corporation, Deloitte, Covis, Dexcom, Eli Lilly and Company, Ferring Pharmaceuticals, Genentech, Gilead Sciences, GlaxoSmithKline, Global Blood Therapeutics, Horizon Therapeutics, Johnson & Johnson, Mallinckrodt, Merck, Novo Nordisk, Pfizer, Philips, Regeneron, Sanofi, Takeda, Xavier, Vertex Pharmaceutical, Village MD, and Walgreens. I want to thank each and every one of you for all that you do. So I want to say safe travels to you all. We look forward to collaborating with you over the year, and next year, bring some real milestones home. So God bless. Good night.